Phase 3 of the electronic blood track system is a safety system for labelling blood samples using a PDA attached to a printer. It must be used at all times where available and if you have received the training to use it. It is used at the patient's bedside to generate labels for group and hold samples, group and cross-match samples, and may also be used for other samples submitted to the laboratory medicine department, for example, your UNE or your FBC sample. There's a few big no-nos associated with using these devices. Under no circumstances, swap your ID badge with anybody. Every time you scan your ID badge, it is the equivalent of signing your name. Do not use a pen on this screen, on the PDA screen. Use the stylus pen provided or use your finger. The cleaning of the devices is very important. They must be cleaned before and after usage. So both of the devices, the cable and the tray, must be cleaned using a Clinell universal wipe. They must be thoroughly cleaned, allowed to dry for 60 seconds, and then dried off with some paper towel. This includes the wire also attaching the stylus pen. The printer must also be loaded with labels, which is extremely easy to load, which you will be shown in the clinical area how to do so. So you will then place the devices on the blue hypodermic tray and proceed to the patient's bedside. So we are going to complete the request form as you would do if you were manually labelling the sample. So to complete the request form, as you are aware, you can use a large addressograph label on the request form, or else you can handwrite the details using black biro on the request form. So ensure you put the patient's surname, their forename, circle their gender, the address, their board number, date of birth, and ensure that you always have the consultant and the location that the patient is under, otherwise it will be rejected in the blood bank. State the time that the blood is required and whether it's routine, urgent or other. Underneath that, this is a cross-match, so I have 2 units written into the box for the cross-match. Further down, if there's any special requirements that's needed in this instance, circle them. CMV negative maybe, or irradiated. This patient has a history of Hodgkin's disease, so we always irradiate patients that have this history. This patient up in the top right-hand corner is going for a nephrectomy. So she's going tomorrow, the 10th of June, for the nephrectomy. She has a history of Hodgkin's disease, as we said. We do know that she's O-rhesus D positive, so we record that. And I have asked her if she had any previous transfusions. She said yes, and that she has never reacted to them. She is not pregnant, and I've also asked her if she ever had a bone marrow transplant in the past or if she's awaiting any transplants, and I know that she isn't. So in the bottom left-hand corner then, I sign my own signature, print my name, my bleep number, a medical council number, and the date and time of the request. So I come back to the form after I have taken the sample from the patient, and I sign the bottom right-hand corner, my signature, print my name, the date and the time. Otherwise, if this isn't done, it will again be rejected in the blood bank, the blood establishment. I'm now going to collect my group and cross-match sample. So I'll perform hand hygiene and apply gloves. I'm using the pink-topped EDTA sample, and I've ensured that it's within its expiry date. When I approach the patient, I ask them to verbally confirm their first name, surname, and their date of birth, and I check that those correspond with the details on their hospital ID band. I proceed to take the sample from the patient, and after I've taken the sample, I remove my gloves and I perform hand hygiene. And I immediately then label the sample using the electronic blood track system. So I take my PDA and I use the yellow buttons to scan my swipe card or the patient's hospital ID band. And the on-off button is up on the top right-hand corner, and I press the function collect samples. It then asks me to scan my identification, so I scan my identification until I hear a bing sound. I then scan the patient's hospital ID band. Verbally, I confirm the patient's ID, their Grace Kelly, her date of birth and her board number and her gender. I've asked her name and her date of birth under the reminders. I checked her identity band. I'm reminded to sign the blood form afterwards. And I now print one label for my group and cross-match sample. So I gently remove the label from the printer and I take it and I ensure that it's fully aligned, that all the details are there, and I place it over the existing label, ensuring that the expiry date and the blood is visible in the tube. All of the patient's details are above the line and the sample taker is below the line, including the date and time. I then sign the bottom right-hand corner of my request form, and I verbally confirm all of the details again with the patient before I put it into the plastic pouch of the request form and direct it to the blood bank immediately. If I have generated any other labels from the device, I ensure that they are discarded immediately in the appropriate confidential manner. I then clean the devices and return them for charging, and I perform my own hand hygiene again.